Call to order this hearing of the Minnesota Senate Taxes Committee. It is Wednesday, April 23rd, 9:05 a.m. The first, and we have a quorum. Senator Housechild, Senator Dibble are attending by Zoom. And we have a quorum. First item on our agenda is adoption of the minutes from April 22nd. Are there any corrections or additions? Seeing none, the minutes are approved as presented. The first bill we're considering is Senate File 2255, Senator Kunesh. Welcome to the committee. Senator Kunesh. We invite you to give us the general description of the items that are in your bill, and we will have some questions, and we're particularly interested in looking at your spreadsheet and also Article 10, Section 1. Senator Kunesh.
Thank you. Thank you, Madam Chair. Just a brief overview of our bill. There are three articles.
Senator Kunesh, we really want a more general, not just this is the omnibus K-12 bill. We really want to know what's in it. You don't have to describe every single thing, but we really want to know what the major provisions of your bill are, where your cuts are, where your spending is. This is the only occasion that some members of this committee will have a presentation of this bill when we can informally ask questions. So I hope you will indulge us. We're very interested, obviously.
Great. So as I was saying, there are three articles in a total of 13 sections that make changes under the tax jurisdiction, and that is in our education bill. I can go through the sections, but just an overview is where we're spending some of the money. In 2026, the LEAs will receive a 2.7% increase to the general education formula. In 27, they will receive up to 3% increase in the general education formula. We are ensuring that districts have modified compensatory hold harmless for 26-27. We're providing additional funding for the special ed and English learner cross-subsidy aids. We're doubling the base dollar amount for student support aid for districts, and we're increasing the flexibility in the school lunch funds, student support personnel, and board district ability to extend referendums. And if you'd like, I can go through the sections, the articles and sections of the bill that pertain specifically to taxes.
That's good too, but we're going to ask about, you can do that now, but we're going to be asking about your spreadsheet, where you're cutting, how similar your bill is to the governor's recommendations. I know you know your bill word for word, and we're going to be asking those things, but go right ahead.
Okay. In section, I wonder if I should, would it be better to have you go through it, or shall I? Oh. Okay. So these are the ones that specifically affect the taxes jurisdiction in our bill. So Article 1, Sections 2, 3, and 16 are in response to concern from consolidated districts relating to the operating referendum reauthorization that we passed in 2023. This year, Rock Ridge Consolidated District passed a resolution to reauthorize their operating referendum under 126C.7 Subdivision B. And MDE denied their request since consolidated districts are not explicitly named in the 23 bill as allowable to reauthorize that referendum. And so we have a bipartisan bill with Senator Clark and Senator Farnsworth authorizing the version of this bill. In Article 6, there are 9 sections related to the taxes jurisdiction. Sections 2, 3, 4, and 5 are Senator Hochschild, Senate File 1198, allowing roof expenses in a district's long-term facilities maintenance plans. So currently, districts with uncapped levy authority can include roof expenses in their LTFM plans. These are often large metro districts, but this language is going to allow the rest of the state districts to do the very same thing. So Section 4 increases the equalization factor to meet that zero levy vote. Section 6 allows school districts to extend capital project levies by board vote. Capital project levies are used for improving security system, HVAC system, energy efficiency, purchasing and upgrading devices, internet, and cybersecurity, and the state allows school boards to renew those operating referendums. Approved rates of recent capital referendum renewal show that public support for this, strong public support for this measure, because over the last 8 years, 29 renewals were placed on the ballot and 29 of them were passed. The cost of running renewals to the district often runs into the tens of thousands of dollars, and those dollars could be better spent in the schools. Section 7 requires review and comment for projects funded with building lease levy proceeds. This is an important transparency provision for the public. Section 8 and 9 definitions will provide clarity to the school districts and the Department for the Lease Levy Program. And in Section 6, we have Senator Rarick's bill that will allow cooperative districts to levy for ice arenas. Under current law, only one district may levy for an ice arena cost, and in the case of consolidated districts made up of 2 or more districts, only one district could levy, and that would lead to an unequal financial share on those ice rinks. And then finally, Article 10, Section 1 is a technical change to help align the dates for county auditors to clarify tax increments, and this should help with financial planning for tax increment finance districts. And that's what I have for you.
Thank you, Senator Kunesh. I would like to turn your attention to your spreadsheet and really like a little bit more explanation about the cuts that you're making, and in particular, your decision to remove inflation, which bore with it a cost that we just recently passed in 2023. I wonder if you could discuss that for us.
Sure. Would you like to talk about UI first? Or would you like to talk about UI first, or would you rather, no, not UI, the inflation, or would you rather hear the spreadsheets?
You can start with the inflation, and there's some other items that I think members are going to be interested in, the amounts that are being cut, and then what your rationale was.
Sure.
Thank you very much. So
we were tasked with a formula, with our targets, $0 in 26-27, and then we had 687.4 in the tails, and that's with the decoupling of inflation. If we hadn't decoupled, we would be making drastic cuts to a number of the most important services that we provide for our students, such as special ed, EL, and those sort of things. So rather than holding those dollars sort of hostage, we thought it was best to temporarily decouple the tax. Oh, goodness. Pardon? Oh, yeah, decouple the basic formula from inflation in order to make sure that we are able to finance those things in the tails. And then, as you will see down the road, that we are going to be very more clear in the bill around restarting that tie to inflation in 2030.
So for the 4-year period that we are responsible for, according to our budget targets, et cetera, inflation will, in this proposal, inflation will not be counted, and it will not be in the forecast. But starting in 3 bienniums from now, you are reinstating it. Am I
Yep,
understanding
it'll click
that?
on, back on in 2030, yep.
Is that the same that you're doing with other cuts that you're making, or some of them do you consider permanent, like the transportation sparsity, then non-public pupil transportation?
Sure. So when we look to the future, it is so uncertain. And I do not feel like it is being responsible if we are holding some of these things tied to future budgets. We see that there are many things being cut at the federal level, and, you know, the intention to dismantle the Department of Education. And I know they talk about parsing that out to all these different committees or agencies at the federal level, but the uncertainty is there. And so it doesn't mean that down the road we will be able to reconsider some of these cuts, but in order to make the targets that we received, these were the best ways that we could go about doing it.
Thank you. And but you are bringing back inflation in the
Yes.
formula allowance. Is that the only spot or only provision? And of course, you know, your bill is this thick, so we only have summaries of sections. We don't, and we have spreadsheets, but we don't, and we have the Senate Council, but we don't have the language. Properly so, quite frankly. I don't think any of us would need that. But is that the only case?
Yes, that is the only case where
Where you're making a
we
cut
pause something and then
not
allow for
respond
it.
and not restoring it?
Exactly. And
Just-
that can be the decision of future legislators.
And I'm sure, as you know, that that is every bill that we have, there are people that support and there are people that object. Is that particular move with regard to inflation part of the governor's recommendations?
No, it is not.
That is a Senator Kunesh
Yep.
recommendation.
Yeah, I was never, I did not feel that that was the way to do it last time around. And of course, that was the House position and the governor's position, which we acquiesced at the end. It feels to me that if we look at the history of how we have funded education, districts have always gotten that 2 to 3%. That's been, you know, historically the way that it's been going. And so as long as I am the chair of Education Finance, I will do my best to ensure that the districts are getting the maximum amount increases in their formula. It's in no way meant to punish or deter anything for the future, but I just feel it is more fiscally responsible to not tie those dollars down when we don't know what the future is, and it's such a, you know, chaotic future to look forward to.
Thank you, Senator Kunesh. Are there other questions or comments for Senator Kunesh? We're going to start with Senator Weber.
Thank you, Madam Chair. One of the couple of questions that I have, first, Madam Chair and Senator Kunesh, Okay, I understand you've reduced the state aid, or taken the inflation factor out of the state aid formula, yet it still increases every year. And could you explain to me what causes that increase?
I'm sorry.
I-
Senator Kunesh?
Oh, thank you. The increase is what we set it at. And so if we look forward, like, for example, it was, the increase was set at, where do we have that? So the formula allowances for right now, for 26-27 have been set at $7,481 per student and $7,705. Those are, and then in 28-29, it also increases. So that's what we've already set them at. Could it change? I'm sure it could change if things were, if we were to have a larger target. But that's where we set it at this time to ensure that, a little bit of sympathy, not sympathy, but support to the school district so they know what to plan for the future.
Senator Weber?
Thank you, Madam Chair. So there was nothing in terms of projected increase in enrollment. It's pretty much, this was an arbitrary amount that was placed into the budget. Is that correct?
Senator Kunesh?
Okay, so those projections
Senator
are
Kunesh? Senator
based on the
Kunesh?
forecast. Oh, I'm so sorry.
You need to go through the chair, I'm
I
sorry.
beg your pardon.
Go ahead.
Okay, so those dollar amounts are based on the projected forecast for the future.
Senator Weber?
Thank you, Madam Chair. Going on to the provision for transportation for our private schools. Now, I believe you indicated, Senator Kunesh, that you had a zero target. But yet, for the next biennium, you've cut them over $100 million. So where did that $100 million go in terms of your budget?
Senator Kunesh?
Thank you, ma'am. Those were spread out to ensure that the resources for our public schools will be there, specifically around some of the increases in special education, around our EL, supporting our school districts for the future.
Senator Weber?
Thank you, Madam Chair. And yet, I believe that one of the reasons for having the state having provided that transportation service was to ensure safe transportation and what have you for all students in the state of Minnesota. Wouldn't that be an accurate statement, Senator Kunesh?
Senator Kunesh?
Senator, I wasn't there when
Senator
this.
Kunesh, you really do need to address the chair before you answer a question.
Thank you, Madam
Sorry.
Chair. Senator Weber, I was not there when the justification for providing those services was created. And so I couldn't presume to answer that question.
Senator Weber?
Thank you, Madam Chair. So how much of this budget goes to cover the costs of unemployment insurance that the legislature forced onto our schools last year?
Senator Kunesh?
Thank you, Madam Chair. Our unemployment insurance, if you look in your packet.
Are you looking at the spreadsheet, Senator Kunesh?
No, I am not. I'm looking at my notes.
Language?
So I just wanted to confirm that we have set aside $100 million for unemployment for our hourly workers. And these are the workers that are the base of our school districts. These are the people that drive our kids to school, feed our students. These are the people that work one-on-one with our students. These are the people that take them to the bathroom, take them to recess, take them to lunch. They put in a lot of time and effort, and there's an expectation oftentimes that they will return in the fall. And so the unemployment insurance is one way to secure the return of a lot of our employees. I know that not everybody returns, but it also does provide them the security, as small as it is, because remember, when you receive unemployment insurance, you're receiving really only half of what your hourly rate might be. There might be some people that are making $16, which means they're receiving $8 an hour in unemployment. And so we added that $100 million into that account to ensure and give, again, comfort to the school districts that that money is already allocated and they won't have to worry about using those dollars in their general funds, nor will they have to levy for it.
Senator Weber.
Thank you, Madam Chair. It just seems ironic that that amount is about the same amount as you're cutting out of the transportation costs for our private schools. And my final statement is, Madam Chair and Senator Kunesh, allowing school boards rather than local voters to renew a capital project. I mean, I've talked to my school districts. They always complain about the cost of those elections. I understand that. You mentioned that 29 out of 29, I think, projects had been approved. But don't you think, Senator Kunesh, that part of the reason that there was 100% approval is that superintendents and school boards know that they have to get the voters' approval? And I think that that perhaps leads to a planned project that meets the needs and the wishes of the voters rather than what they might like. And I'm assuming, and I'm willing to guess that within the next decade, we will have, as senators, have a number of constituents call and say, you need to get these projects back under control. Because without the voter approval, I think we'll have a few projects that tend to go much farther than the voters would like to see them go. Final statement, Madam Chair.
Thank you, Senator Weber. Senator Nelson.
Thank you, Madam Chair. I have just a couple comments and then a few questions. You know, first, I think a little bit of praise is in order. I appreciate the fact that I heard you say that you really focused on the per pupil formula. And that is key because that does give school districts the greatest flexibility to do exactly what they need, not what we think they need up here. So I appreciate that. And I have one question to that point on the formula. About what % of the total K-12 budget or pre-K-12 budget is the formula now? So we have maybe 13 categorical funding streams, which somehow seems to get lost when people talk about education funding. Sometimes they just compare the per pupil formula and say, oh, it didn't keep up with inflation. However, the accuracy would be, well, what about the full funding from the state? And that does include that categorical funding. And I'm just wondering about what % of the total K-12 budget is the per pupil funding? I think that's important to know. I think that's important for Minnesotans to know, especially when they hear comments about how education is or isn't keeping up with inflation.
Senator Kunesh.
Thank you, Madam Chair. I'm going to ask one of our SCRFA folks if they have been able to calculate that. Just take a moment. Thank you.
Madam Chair?
Senator Nelson.
In order of time, to keep our committee moving, if it's going to take a while to get that number, I'll continue on with my questions.
Madam Chair, I think we have the
Senator
answer.
Kunesh.
I think we have the answer.
Oh, beautiful.
Madam Chair, Senator Nelson, it's not exactly your question, Senator Nelson, but when you're thinking about the basic revenue as a share of total school district general fund revenues, you know, excluding nutrition funds, excluding debt service, excluding community ed revenues, the share of that general fund revenue that is the basic revenue is roughly 50%. You know, and thinking about the kind of long-term trend over the last 25 years, in general, that share has been decreasing over the last 25 years or so to roughly 50% today.
Thank you.
Senator Nelson?
Thank you, Madam Chair, and thank you for that clarity. I think that's important. So about 50% of our state funding is to that per pupil funding, that basic share. And then there's an additional 50%, which I guess we would call those categorical type funding streams and others. So when Senator Kunesh, so on the inflation side then, you had some comments about how education funding now in this bill has been decoupled from inflation. And I just want a little bit more clarity on that. Some elements of the K-12 formula are automatically tied to inflation. I can't remember all of them. I think maybe one of them is community ed, for example. And so of the decoupling, when you talked about decoupling it from inflation, are you just talking about what happened in 2023 when the budget was put on automatic inflation? Is that the decoupling you're talking about? Or I thought maybe there was some other decoupling. What, kind of explain that, what that decoupling from inflation actually includes.
Senator Kunesh, but Senator Nelson, I need to remind you as well, you need to go through the chair before you answer the
Madam
question.
Chair.
Senator Kunesh.
Thank you, Madam Chair. It is our intent to decouple just the formula from the inflation.
I think Senator Kunesh, I believe she is asking, is it only as a result of the 2023 bill, or does this decoupling refer to other inflationary pressures on your bill?
Thank you, Madam Chair. And Senator, it is just from the 23 bill.
Okay. Senator Nelson.
Thank you, Madam Chair, and I'll try and be brief here. I appreciate your latitude here. So the decoupling happened just in regards to the 2023 bill. It did not decouple other automatic inflationary factors in the K-12 formula, and I want to make sure I understand that.
Senator
Chair.
Kunesh.
So when we delink the formula, there are other areas that are connected that are linked to, some of those inflation things. So they also are then temporarily paused.
Oh.
Senator Nelson.
Thank you, Madam Chair. That is quite a departure to delink from those. I'm glad that was clarified. I don't know that that was very clear. And then on just a more precise question on the LTFM, I understood
Senator
that-
Nelson?
Oh, Madam Chair.
You need to go through the chair before you
Of
ask a
course.
question.
Madam Chair. Madam Chair. So on the LTFM, I had a question on the equalization in LTFM. I thought you described something regarding that there was no state expense, perhaps, with the LTFM change, but yet it factored in equalization, and I just wanted to know how that equalization, because our levies do have, I think, like 3 levels of equalization, how is that paid for?
Senator Kunesh.
Thank you, Madam Chair. I'm going to ask Ms. Holford to respond to that.
If you'd identify yourself for the record.
Madam Chair, my name is Jenna Hofer. I'm the nonpartisan fiscal analyst assigned to the Senate's Education Finance Committee.
Welcome to the committee.
Thank you, Madam Chair. Senator Nelson, to your question, in Senator Kunesh's opening remarks, she discussed a proposal that would provide additional long-term facilities maintenance revenue to districts for the costs of roof repair and replacement. As you know, long-term facilities maintenance revenue is a combination of the levy and an equalized aid program. And in order for this proposal to remain levy neutral, so to not increase property tax levies on a statewide basis, the proposal would increase the amount of equalization aid in the formula. So total revenue is increasing for the program, but that's all on the aid side of the formula. It's not on the levy side. So if you look at the state aid appropriation tracker in your packets, on page 4, line 161, you'll see an increase to long-term facilities maintenance equalization aid for roof repair and replacement in the amount of $2,970,000 in fiscal year 2027, $4,920,000 in fiscal year 2028, and $5,010,000 in fiscal year 2029.
Senator Nelson?
Thank you, Madam Chair. So there is a state cost to that, then a little over $10 million, if I understand that correctly. So that brings me to probably the most, well, one of the things that concerns me the most, Senator Kunesh. So it's, quite frankly, I don't want to be judgmental, but it does seem to be that the priority, like in this case, is about roofs on our school buildings. But there's this trend that I see coming this year, especially as it comes through the tax committee, that is really concerning. And it has to do with our non-public schools. In other words, anything, like, for example, I understand your bill, Senator Kunesh, cuts transportation to non-public school students. And I want to remind people and the public that those parents who choose not to use the public schools, but choose to pay tuition to send their child somewhere else, are now being denied transportation, if I understand your bill correctly. And I just think that is very unfortunate. And as I said, it appears to be a trend, which maybe I'll talk about later. So that is concern to me. So removing the transportation, Madam Chair, that's on top of what we heard yesterday, which was, I think, Senator Putnam's bill, which would tax unrealized gains for our public colleges and universities. And then I think it was Senator Port's bill that would further cause a hardship for non-public, that would not allow the tax credit for homeschoolers. So there's this trend that I think is very dangerous. And on your bill, I'm just concerned about the transportation piece. I've used up a lot of time, Madam Chair. I will just say one more thing that I think is critical, and that has to do with the summer employment. I have heard from actually all of my school districts, either their superintendents or their school board members that are kind of the lobbying group of the school board members who come to the Capitol. And this piece, while intended, is causing significant problems. And there are some small tweaks that could make it better. What's happening in our schools is that, number one, because of the unemployment piece, which is, I understand, 50% of the wage, some employees are choosing to not fulfill those other jobs that were usually done in the summer by perhaps our paras. One of those happens to be childcare, because if you think about it, when kids are out of school, the childcares that are in our schools, those kind of balloon, and they need extra hands on deck. But what's happened with this particular part of the unemployment mandate is that it's not considered like employment. So in other words, a paraprofessional who's in the classroom, who knows the kids, who knows the school, who knows the staff, who knows the families, it's not considered like employment for that teacher then, or that paraprofessional in the classroom, to be now a child care, caring in the child care aspect of the school-age summer childcare. So there's just some things, Madam Chair, members, where I wish there were a little bit more discussion in trying to make these things that were passed previously, maybe without as much discussion as they needed, or just the fact that we learn. We learn, and we come back and we should be amending bills as we see how they're rolling out. This is a problem, I think, and so, Senator Kunesh, I would appreciate if you, going forward, could actually speak a little bit as you go through your negotiations with this unemployment piece, and I'll be glad to talk with you offline if there's, I do think there are some things that we can do to make it more tolerable for our schools. And so I'm just concerned about some of the, I would say, priorities that are hurting Minnesotans in this case. So I'll just leave my comments there. I don't want to take up too much
Thank you.
time, Madam Chair.
Thank you, Senator Nelson.
Madam-
We have
Madam Chair?
allocated.
May I respond?
Senator Kunesh, I think she is asking for ongoing conversations rather than a response right now. We do have, we had allocated 45 minutes for each bill, so if you, can you be very
Quickly.
brief? Because
Yep.
we have other people who want to ask questions, and we have about 6 minutes.
So when, thank you, Madam Chair. So
Senator Kunesh.
when we talk about the transportation, schools, non-public schools can still contract with the public schools for transportation. So while we're not denying, we're just saying that the state won't pay for it. And I just want to bring us back to our state constitution. Because if you look at our state constitution under Article 13, Section 2, there's a prohibition to aiding sectarian schools. And it states, in no case shall any public money or property be appropriated or used for the support of schools wherein the distinctive doctrines, creeds, or tenets of any particular Christian or other religious sects are promulgated or taught. And so that was not an easy decision for me. I understand the complexity of transporting children to all the schools that we have in our district. But when we look at our Constitution, right there, it states that we are not to be using public dollars for non-public transportation or services. So I just wanted to make that statement.
We might not get to Health and Human Services, Senator Kunesh. Senator Weber.
Thank you, Madam Chair. But it's also my understanding that the transportation provision has been upheld in court.
Yes.
So that's all I have to say. Thank you.
Thank you very much. Senator Drazkowski.
Thank you, Madam Chair. Thank you, Senator Kunesh. Senator Kunesh, first time I heard you invoke the Constitution. So thank you for going there. Your bill spent $2.2 billion increase in the last biennium. Huge increase. It also brought with it 65 state mandates. And then in 2024, you had another 7 or 8 more mandates. Over 70 mandates that are squishing our schools in our district, in our districts. Many of them are struggling to stay afloat. So my question to you is, which of these mandates have you retrenched on? Which of them have you said, you know what, we need to relieve the pressures placed on local school districts so that they can afford their property taxes? We're seeing large property tax increases. There's large property tax increases structurally built into those schools because of what you passed in these bills. The 2 mandates that really stick out are the one where we pay people not to work. We tell school districts they have to pay people not to work, which is one of the most insane ideas I've heard. And the other one is the one where we tell school districts that they have to pay food welfare for the 60% of the families that can afford to pay food for their kids themselves. Those are the 2 I hear the most. Those are the 2 most impactful. So my question to you is, have you, in this bill or in your deliberations, looked to remove those two mandates or any of the other mandates, the 70-plus mandates that you passed in the bill 1 and 2 years ago?
Senator Kunesh.
Madam Chair, I will say that we did not consider repealing the UI insurance, nor did we consider repealing feeding our children. And if there are parents out there that feel like they can pay for their students' lunches, there's nothing that says they cannot. They can absolutely pay for their students' lunches, and if they rather not pay for the food, they can always use those dollars and donate them to the school or to their children's classroom, or provide those dollars to the school in whichever way they want. So there's no prohibition against paying for lunches. We're just saying that if you choose, you may have a lunch or a breakfast at no cost. Did we work on any of the expectations? And when we talk about mandates, I have yet to see this list of 70 mandates, so I don't know exactly all the ones that you are talking about. Anytime we pass a law, that's basically a mandate. We're telling public service, we're talking about healthcare, whatever it might be. When we pass a law, that's basically a mandate. And so the expectation is that we put into place resources and policies that we would like to see accountability and transparency through. And so when we ask for those kind of things, using our public dollars, I think it's not unreal that we would ask for some accountability. What mandate or what piece of legislation might we have changed? We have asked the schools to remove any mascots or depictions of American Indians that are offensive. And there was a process for it that we thought was going to work. It didn't work the way that we thought it would. So I have in my bill an adjustment to that process, and recognizing that having to replace signage or a gym floor would cause a hardship to those schools. We have dollars in this bill to assist with that as well.
Thank you, Senator Kunesh.
Madam Chair?
Senator Drazkowski, and then I do ask for your indulgence because our job is to also pass another bill or to at least take action on another bill, if you'd be very brief.
Yes, I will. Thank you, Madam Chair. Thank you, Senator Kunesh. Thank you for the Indian mascot provision in your bill, which turns it, as I understand, turns it over to the local tribes to work with their school district, which I think is much more flexible and is going to help resolve some of that. I thought that was good leadership on your behalf. However, we still have 70-plus mandates that have the state of Minnesota having its foot on the throat of our school districts, and we need to figure out how to remove that because it is going to result in, it is resulting in huge property tax increases and inability for our districts to operate. And Senator Kunesh, I mean, if welfare is offered to any group, whether it's food welfare or the $1.3 billion in the working family credits, child care credits that we have in our bill here, that's welfare, or even the bicycle welfare that we entertained before this committee the other day, which I understand still has $2.2 million for bicycles for people. People are going to flock to that. As a matter of fact, the bicycle welfare, Senator Kunesh, was described as unbelievable amount of interest within seconds. The appetite overwhelmed the amount of money that was available. When government offers free things to people, people are going to flock to it, no matter what it is. The question is it good policy decision here for us to be forcing school districts to pay for welfare for their families that don't need welfare? And that's the question we have. And there just seems to be this ideological drive to force these mandates on our school districts, and they're not able to afford them. And we're going to see, we're already seeing property tax implications. We're seeing school districts are having problems making cash flow. And I don't know why there is this recalcitrance among the majority to not entertain what our school districts are saying. We're not listening to the school districts in our state, and we're forcing this stuff on them, and we could easily back up on some of this stuff, give them the flexibility they need. They wouldn't have these property tax pressures. They wouldn't have these budgetary pressures. And at least from the school districts I see in my legislative district, they would really appreciate that, and that's what they're asking for. So I hope we can have some change in this bill between now and what's actually enacted into law, and give them some of that flexibility that they're begging for. Thank you, Madam Chair.
Thank you, Senator Jaskowski. Senator Miller, briefly.
Thank you, Madam Chair. Senator Kunesh, did I hear correctly that there are cuts to non-public transportation aid in your bill, but, excuse me, there's funding for schools to replace logos on their gym floor or in their gymnasiums? Did I hear that correctly? So there are cuts to non-public transportation aid, but yet funding to change logos or replace logos on gymnasium floors.
Senator Kunesh.
Thank you, Madam Chair. Yes, there are school districts in our state that use mascot names and images that are perhaps inappropriate and detrimental to the American Indian communities here in our state. And the tribes have asked the schools to please remove them. And so we did pass a law that says you must remove them, come up with a different mascot and a different logo, whatever that might be, that is not offensive to our tribal nations. And so as we heard about that from the districts and their requests for funding to help do some of those things, especially if they have to remove some things from their school, the best way would be to provide them some one-time money, so it's not ongoing money every single year the way transportation is. And that would hopefully provide closure to this issue, and so we thought it was best to do it that way.
Thank you. We are now, Senator Nelson, you've had a great deal of attention to ask questions, and you have said that you would pursue further conversation offline, so that's what we're going to do. And I'm going to call on Senator Klein for a motion.
Thank you, Madam Chair. Thank you, Senator Kunesh. Thank you for an excellent bill in front of us. I'd like to move that Senate File 2255 as amended, Senate File 2255 be recommended to pass and sent to Finance, and I request a roll call.
There'll be a roll call.
Chair Rest,
Yes.
Senator Klein,
Yes.
Senator Weber. No. Senator Dibble,
Yes.
Senator Jaskowski,
No.
Senator Hauschild,
Yes.
Senator Hauschild, you have to have your camera on.
Yes.
Thank you. Sorry, that's the
Senator
rule.
Miller,
No.
Senator Nelson,
It looks like a Jawa.
Senator Putnam,
Yes.
There being 5 ayes and 4 nays, the motion prevails, and the bill will be sent to Committee on Finance. Our next bill is, thank you, Senator Kunesh, very much. Our next bill is Senate File 2669, Senator Wiklund. Senator Wiklund brings us Senate File 2669. We'll ask for, again, some general comments about your bill. I know that it's very intricate, and we don't need, just like before, we don't need the big, we don't need the detail, but we would really appreciate a general overview of, in particular, where you, that you could direct our attention to where you made cuts in order to meet your target in the service of balancing our budget. I would direct members' attention that there are at least actually three amendments that I'm aware of that we will take up after your general presentation and before questions. Okay? So Senator Wiklund, to your bill.
Thank you, Madam Chair, and thank you for allowing me to present Senate File 2669 today. This is the HHS Omnibus Finance and Policy Bill. Within this budget target that we were given, we needed to think about ways to protect access for Minnesotans to health care, given the great uncertainties at the federal level. We were not interested in simply meeting our targets through cuts, and so you'll see as I go through the presentation and other ways that we've chosen to meet our budget targets. But some of our main priorities and how we fulfilled them in the bill, we wish to strengthen access to health care. As I mentioned, we've avoided cuts to basic coverage. We have added some key low-cost coverages for public programs that will have a meaningful impact on public program enrollees, such as reimbursement for home birth services. This was something the HHS committee discussed as being not only a benefit for enrollees, but as a way to potentially lower costs in the future if people have access to some of these lower cost coverages. Other couple items that are really important in the bill, access to telehealth was something that we wanted to continue audio-only telehealth for Minnesota Public Program enrollees, and also access to HIV programs. We also discussed innovating in our committee, innovating to address barriers that patients are experiencing in accessing the care that they need. So we have provisions, for example, like a formulary requirement that will allow people to access a medication that they are on for their full contract year, rather than if a plan decided to make a change mid-year and would cause the enrollee to have to either pay significantly more out of pocket or make it inaccessible. This would resolve that for the contract year. Another area that we looked at was considering impacts that we are already seeing due to federal cuts and federal economic decisions. We've seen a great increase in food insecurity in the state, and so we have allocated some funding to address food insecurity in Minnesota through food shelf and food bank allocations. We also have support for a couple of programs that address homelessness, and they are ones that are serving unique and increasing needs for access to homelessness services for the elderly and also for families. These are areas that we see growing and increasing needs across the state. We also looked to address key areas of concern for families and those who work with families in addressing systems that support families. The SSIS system, we are reallocating some funding so that that project can move forward more quickly than had been planned. We fund a fiscal analysis study that allows us to better understand the child welfare funding system, which we feel is greatly important to not only to families, but counties and state entities. We need to understand better how much funding we have coming in for these programs and how to better access it or better use it. We also have funding to strengthen program integrity and the governor's budget item that has to do with increasing fraud prevention and in the Department of Human Services. So those are some of the general areas. In terms of items in the bill that may be of most interest to the tax committee, there are two provisions in the bill that have already been before this committee, Senate File 1402 and Senate File 2413. Senate File 1402 was a bill to raise reimbursement rates for certain outpatient mental health and physician services in our public programs up to the Medicare level. This increase is funded through an assessment on health insurers that is leveraged by the state to draw down new federal matching dollars. This helps our struggling healthcare providers across the state and promotes the long-term sustainability of our public healthcare programs. A new item that was added in the omnibus as part of that, that provision was to add a proposal that encompasses an increase in reimbursement rates for EMS. There is a 15% increase in all EMS rates and an additional 10% for rural EMS. Senate File 2413 was a bill to provide a new directed payment program or payment to hospitals via our public health care programs. This bill is funded by an assessment on hospitals that is used to draw down additional federal matching dollars. These dollars represent a significant boost to hospital budgets at a critical time for both inpatient and outpatient hospital services. Both of these bills together represent a historic investment in our public program infrastructure. We have known for a long time that reimbursement rates are abysmally low. Directed payment programs like these are already used across the country, so we have the opportunity right now to do something truly transformational that helps healthcare providers and fortifies access to care. This bill also contains an alternative to our existing reinsurance program, which is only funded through the end of this year. The portion of the bill may be of interest to this committee because of how the program is funded. The new 20% subsidy program would replace our current reinsurance program with a direct subsidy for the individual insurance market. The subsidy accomplishes the same effect as reinsurance by lowering premium costs by 20%, but better targets state dollars where they are needed and untangles us from the federal waiver process that adds complexity and uncertainty to the state budget. Our budget target does not support funding this subsidy of the reinsurance program with general fund dollars. But it is critical that we find a way to maintain coverage for the thousands of people who would otherwise see premium costs rise without this support. Therefore, the subsidy program is funded through an assessment on the state's health insurance companies. Most state reinsurance programs are paid for by assessing insurance companies, so this bill proposes to fund our reinsurance alternative in the same manner. Projected state costs to fully fund the new subsidy are lower than the projected state share for reinsurance. Another provision related to that is of interest to this committee, the provider tax is restored to 2% in this budget. As part of the budget building process, we had to take into account the target given to us and the many needs and fiscal uncertainties we have heard about over the last few months. So this bill also includes a restoration of the provider tax to its original and longstanding level of 2%. This change represents just an additional 0.2 cents per dollar, but its impact is significant, helping us maintain stability in health coverage for over 1 million Minnesotans and protecting the tremendous progress we have made in recent years. Restoring these funds maintains our fundamental commitment to healthcare access for Minnesotans. When looking across this budget as a whole, I believe all the components of this bill work together to put forward a responsible approach to making ends meet in a challenging and uncertain time. And Madam Chair, as you mentioned, I personally have two amendments. The A50 is a technical amendment, and then the A47 is a non-technical amendment. And I can proceed with those whenever you would like.
Yes. Senator Klein moves the A50 amendment. It is in members' packets, and it is a technical amendment referring to effective dates. Anything further than that, Senator?
Madam
Wiklund?
Chair, no, it is, as you say, we realize that the effective dates for the part of the bill that had to do with the provider tax were not included, and so this adds
Thank you
that
very much.
information.
All those in favor of the A50 amendment, please say aye. Aye.
Aye.
Opposed, say no. The motion prevails and the amendment is adopted. Senator Klein now moves the A47 amendment, and we'll call on Senator Wiklund to explain it. Senator Wiklund, and in doing so, I draw your attention to the revenue estimate that is in the bill that gives us the impact of this amendment on Senator Wiklund's bill. Senator Wiklund, you want to explain how this amendment came about and what it does?
Madam Chair, thank you. The A47 amendment came about as a result of a court case that happened last November. In the past, the collections for wholesale drug distributors for the provider tax, the original collection was to include the gross revenues that included rebates that the wholesale drug distributors might offer. A court decision in November determined that the language in statute did not state that clearly, and that the rebates would not be included in the gross revenues that they reported, and thus the tax would not be collected on the gross revenues. So what this amendment does is to put in statute language that clarifies what the gross revenues includes for wholesale drug distributors, and that any rebate provided by the wholesale drug distributor to a customer, however provided, is something that needs to be included in their gross revenues that are reported, and thus the provider tax then would be collected on the entire amount. And so the revenue estimate that you have, it shows what that difference is in collections, and it also includes, it's based on increasing the provider tax back to 2%. It includes that aspect of the provision as well. And I have more information, or our Senate Counsel can speak to the amendment as well.
Thank you, Senator Wiklund. Any questions on the A47? Briefly, Senator Nelson?
Thank you, Madam Chair. On the rebates, so is the A47 then adding the upgraded, now the 2% provider tax, if your bill were to go through from 1.8, to rebates that are given to customers? In other words, those rebates now are being socked with the provider tax? Is that what you're doing, Senator Wiklund?
Senator Wiklund?
Madam Chair, Senator Nelson, so today, because of the court decision, the court ruled that the language currently in statute says that gross revenues should be interpreted as the full amounts invoiced and total amounts received in money or otherwise. But the court said that the legislature did not indicate that that is a clear intention to require drug wholesalers to report the full invoiced amounts, including rebates. And so this clarifies that the intent is to include all amounts. And these are rebates that wholesale drug distributors use with their customers.
Senator Nelson.
Well, I'll just be real brief, but having spent about 10 years on Health and Human Services, I know it's complicated, but this seems to be very ill-conceived that then we are going to put the provider tax on the money that is not collected, basically. I think that there's a lot of things I'm concerned about regarding this provider tax. I'll maybe save those comments for later. But on this A47 amendment, Senator Wiklund, I think there is a better way to acknowledge. I think those rebates should go to the customers. But anyway, I will just leave it there. That's very concerning. So now we're taxing money that no one is collecting, but the state is taxing on money that has not been collected. That seems very strange.
Senator Wiklund, a final comment before we vote. Oh, I'm sorry, Senator Drazkowski.
Thank you, Madam Chair. I just wanted to confirm that what we're looking at in this amendment is a $26.6 million increase in taxes for the upcoming fiscal year, and then a $33.4 million tax increase for the out biennium. Do I understand that correctly?
Senator Drazkowski, that's the way I read the
Thank you.
revenue estimate as well. Any others? Then Senator Klein renews his motion on Senate file, on the A47 amendment, and there will be a roll call.
Chair Rest,
Yes.
Senator Klein,
Yes.
Senator Weber. No. Senator Dibble,
Yes.
Senator Drazkowski,
No.
Senator Housechild,
Yes.
Senator Miller. No. Senator Nelson,
No.
Senator Putnam.
Yes.
5-4.
Thank you very much. The motion prevails and the amendment is adopted. Senator Klein.
Madam Chair, I offer the A49 amendment. I'm willing to speak to it. It's in members' packets.
Thank you. We have the A49 amendment in front of us. Senator Klein.
Madam Chair and members, the A49 restores the language of the Health and Human Services Bill to the original language authored by Chair Wiklund and is a significant patient safety measure that will prohibit anyone other than a certified surgeon and ophthalmologist from injecting the eyeball directly or the intermuscular tissues around the eye. Members, these procedures, the eye and the nervous structures that feed the eye are parts of the human brain. The operations and the procedures that affect those organs are the most intricate procedures within medicine. They are literally brain surgery. It is important that Minnesota not join the 5 states in the country that have expanded this practice beyond the domain of surgeons, and that we preserve the health of Minnesotans' eyes and brains by confining injections to the eyeball to ophthalmologists and surgeons. That is simply what the A49 does. It restores language to the original draft of the HHS bill. It is a patient safety measure, and I ask your support.
Senator Wiklund, do you have a comment on this amendment?
Madam Chair, I would support the amendment. I did include the provisions from the optometrists, the stakeholders put forward this year that had to do with pharmacology. I have included those in the bill, and I would like to not include the language around injections because of concerns that I have myself and as have been raised by Senator Klein. and others. And I believe that we should have more discussion about this by not including it. You know, it leaves open the ability to talk about it further, but I think I would really prefer to not include it in the HHS omnibus. Thank you.
Thank you, Senator Wiklund. Senator Weber.
Thank you, Madam Chair. You know, the previous two amendments were issues that I think the Tax Committee was qualified to deal with. I don't think this amendment is an issue that this committee is qualified to deal with. The amendment that is being taken away from the bill was actually added in HHS committee through the amendment process and voted on by members who deal with these issues. And so I understand that we have the ability to do this, but just because we can doesn't mean we should. And if we're going to take a vote on this issue, I would like to see if there's someone, if there's an optometrist, someone from the optometrist organization in the room that could provide some information.
Thank you, Senator Weber. We don't usually take testimony, but I have indicated that if this amendment was presented, that we would welcome that. And so, but we did not get any requests from either ophthalmologists or their representatives or the optometrists or theirs. But if there is someone who would like to testify either in support or opposition, they're welcome at the table for a couple of minutes. And I would ask your counsel if they would step aside while the testimony is being taken. Welcome to the committee. If you'd identify yourself for the record.
Thank you, Madam Chair. My name is Shep Harris, and I'm here today on behalf of the Minnesota Optometric Association. Appreciate this exception to the situation, and thank you, Senator Weber, for asking the question. On behalf of tens of thousands of patients that the optometrists serve on an annual basis, they support the language as it is currently in Senate File 2669, but oppose this amendment. To Senator Weber's point, this issue has been around for quite some time. I'll just state very bluntly what the problem is and what we believe the result is because of the problem and the solution. The problem is that statewide patients have access issues to getting timely eye care, to the point where the optometry board has testified in the health committee, both in the Senate and in the other body, that this is actually, they've used the term a public health crisis. If the scope is not updated, that there is a public health crisis. In fact, the Minnesota optometry scope is one of the last rankings in the country when it comes to scope. You have roughly 300 ophthalmologists in the state, but you have 1,100 optometrists in the state that are trained and can do this. But because of the scope issues, they're not able to do what they've been trained to do in optometry school around the country. And in fact, so the result is that patients are waiting exceptionally long periods of time, or in some cases, they're actually, from some of your districts, driving to any of the surrounding states to Minnesota to take care of something as simple as a sty, a lump, or a bump on the eyelid that could be taken care of with anesthesia and then removed. But unfortunately, optometrists in this state right now, based on the scope, are not allowed to do that. Ironically, though, you might laugh at this, but ironically, estheticians and tattoo artists can actually do more around the eye right now than what's in state law for optometry. And so what we're proposing is a compromise, actually, with what's currently in Senate File 2669 is a compromise. This has been worked on over the past 20 years. As recent as this goes back to 2020, when actually Senator Klein suggested that we put a time limit on oral steroids. So the optometrists agreed to that. And so that's why in the bill you see a 14-day limit on oral steroids. You'll also see other restrictions in there, such as retrobulbar, subtenons. That is language that over the past several years, the optometrists have agreed to slowly compromise and whittle back their scope. Lasers, which have been taught in optometry school for more than a decade. That's not even in the bill. It's never even been in the bill. So the original bill that was offered back in 2020 was already a compromise version. So we keep slowly scaling this back further. And the optometrists feel like, for the sake of patient eye safety and eye care, that they've been trained to do already, that the language as is sufficient. We will not be at the top of the pack, by no means. We will not be a leader in the country. We'll be in the middle of the pack at best. So I also just want to point out, you'll see the word intravitreal. That was something that when Senator Benson was the chair of the Health Committee, she was uncomfortable with that. So that's also a restriction. You'll also see, well, I already mentioned the subtendons and the retrobulbars bars. That is at the back of the eye. Whereas what optometrists are just asking for as proposed language is to work around the eye and at the surface of the eye. So I hope that helps a little bit, but I would echo Senator Weber's comments. Rely on your colleagues' expertise who have not only been dealing with this issue for the past 4 or 5 years in committee, but also who understand the current political dynamics of the situation and how it's been playing out in the committee, in the Health Committee as well. Thank you, Madam Chair. Appreciate that.
Thank you.
Happy to answer any
Mr.
questions.
Harris, Senator Weber?
Thank you, Madam Chair. And I think that's the one point that I want to reiterate is that in defense of the amendment that was made, it talked about the training and what have you. And I just wanted to make sure that the optometrists are quite frankly trained to do what the current bill would allow them to do. Is that correct, Mr. Harris?
Madam Chair.
Senator, Mr. Harris?
Thank you, Madam Chair. Senator Weber, correct. In fact, had we known that this amendment was going to come forward before 24 hours, I would have submitted plenty of information here that shows the coursework that they take. And in fact, I can tell you, to Senator Klein's point, he was talking about brain surgery. One of the courses that they actually take is about, in fact, I have to find it here, but it's specifically about neuroanatomy and physiology. So they take 3 years of coursework, and year 4 deals with rotations. So there are thousands of hours that are done on what they've been trained to do. We're not asking to do more than what they're already being trained.
Thank you, Mr. Harris. Senator Klein, would you request a roll call, please?
Roll call requested.
Further discussion? Seeing none, the secretary will take the roll.
Chair Russ,
Yes.
Senator Klein,
Yes.
Senator Weber. No. Senator Dibble,
Yes.
Senator Drazkowski,
No.
Senator Hauschild,
No.
Senator Miller,
No.
Senator Nelson,
Yes.
Senator Putnam.
Senator Putnam is out in the hall. We'll wait for him if you're with your indulgence. Let's see. Senator Putnam, we're in middle of a roll call on the A49 amendment offered by Senator Klein.
Thank you, Madam Chair. I apologize for my absence. I'm no.
All right. The motion does not prevail. The amendment is not adopted. We now are on the bill itself. Are there further brief comments before we take a vote on the bill? Senator Weber.
Thank you, Madam Chair. Thank you, Madam Chair. I think there's probably a number of things, but it's my understanding, Madam Chair and Senator Wiklund, that in your committee, it was the fiscal note in your committee actually talked about some of these payments would become taxable income. Has any further information been received regarding that?
Senator Wiklund.
Madam Chair, Senator Weber, and I gather that you're referring to our subsidy provision in the bill that would provide the subsidy, 20% subsidy to
Correct.
Minnesotans for, who are on the individual market. We have requested review and consideration of, whether these would be considered taxable. The initial fiscal note, I don't believe we've received a revised one since more consultation has happened with MNsure. It indicated that they were thinking that it might be considered taxable income, as you mentioned. But we haven't, as to my understanding, we haven't received updates on whether that has been determined. And to me, it seems like the subsidy is not payment that is actually going to be received by the Minnesotan and then applied by them to the payment. It's something that would be shown on their bill as a 20% reduction in their monthly payment. But we need to get that clarification, yes.
Senator Weber.
Thank you, Madam Chair. Regarding the premium subsidy on assessment, it's, well, number one, exactly how much do you expect to raise from the health insurance companies on that, with that amount?
Senator Wiklund.
Madam Chair, Senator Weber, we would raise the amount that is needed to cover the costs of reducing the premiums by 20%, which I don't have that fiscal note in front of me to, with the numbers, but it is comparable or less than what we have been putting into the program for reinsurance. And it's something over $200 million, I believe, the first plan year, and I think it's something over $300 million the second year, but I'm sorry, I don't have that fiscal note in front of me.
Senator Weber.
Thank you, Madam Chair. It's also my understanding that in the original fiscal note, MNsure had said that they would not be able to have this new plan operational until 2027. Is that correct, Senator Wiklund?
Senator Wiklund.
Madam Chair, Senator Weber, that is what they stated in their first fiscal note, and we've since had discussions with them about how to operationalize the program so that it would be possible to implement next year.
And
Senator
thank you,
Weber.
Madam Chair. And is there a plan in place, or is this still an unknown?
Senator Wiklund.
Madam Chair, Senator Weber, it's still being discussed on how we can operationalize the program, but I believe that based on the work that we've done, that there would be a way to do it, to implement it in 2026.
Okay. Madam Chair.
Senator Weber.
Thank you, Senator Wiklund. It just seems to me there's a lot of unknowns within your bill for it to be at this stage. I've been told that the 3 tax increases alone will raise healthcare costs in excess of, roughly $560 million. And it just always amazes me how we continually complain about the high cost of healthcare, and yet the state of Minnesota becomes one of the chief culprits in raising that cost. And I guess with that, Madam Chair, I will stop.
Thank you, Senator Drazkowski.
Thank you, Madam Chair. Thank you, Senator Wiklund. Senator Wiklund, Article 6 is your your bill that you brought before the committee, you mentioned 2.8% assessment on health plans to set up for some sort of match from MA, some sort of loophole, as I understand that other states are approaching or pursuing. If the federal government closes that loophole, Senator, will the monies that were collected be returned to where they were taken from? And is that in the bill, if so?
Madam Chair, Senator
Senator
Drazkowski, the program would rely upon federal approval, and so we would not proceed with implementing the collection of the assessment until we had federal approval. And the bill also contemplates if federal approval is, somehow goes away during the period that after they approve it, for example, and we are collecting, then requires the commissioner to go back to, the way the rates were reimbursed before this proposal. So we're not going to be able to collect any of the assessment until we receive federal approval.
So, Madam Chair?
Senator Drazkowski.
Thank you, Madam Chair. So Senator Wiklund, thank you for that. So if we do get federal approval and the assessments are taken and then federal policy changes, what will happen with the money that's collected at that point, and will the collection mechanism shut off?
Senator Wiklund.
Madam Chair, Senator Drazkowski, the collection method would need to shut off. I guess the timing of, what's been received and what's dispersed and how that would overlay with a federal requirement to stop the program or change it. I'm not sure that I can tell you exactly how that would, anticipate how that would work, but obviously if we don't have the authority to disperse amounts that are collected, I would think that they would have to be returned, the assessment would have to be returned if there was something collected and we did not have authority to disperse it in the form of additional payments to hospitals or providers.
So, Madam Chair?
Senator Drazkowski.
Thank you, Madam Chair. So thank you, Senator Wiklund. So could we have that in the bill so that we actually say it? You're concerned about the paying out side. I'm concerned about the collection side. Can we have the collection side be clear in the bill as well as it comes to the floor so that in the eventuality that federal policy changes direction and the rug is pulled out from under the program, that we stop taking the money and we also return the money that's been collected that isn't being matched. One last question I would have for you.
Senator
So that's that question. And one last question. Do you have a total amount, Senator Wiklund, of the tax increases in the bill? I saw the fee increases were about 70 million, a little over 200 million in the 11% per fighter tax increase. What about the other areas? Have you done a back of the napkin total of how much tax increases in this bill, tax and fees?
Madam Chair.
Senator Wiklund, is that reflected on your, just as an added thing, is that reflected on your spreadsheet, the tax increases or revenue increases, however you want to?
Madam Chair,
describe
so it depends on the area. If you're looking at fees, and that may be like health-related fee or health board-related fees or fees to implement services that the health department offers, those are reflected on the, those increases are reflected on the spreadsheet. I have not totaled, what those are. Those are designed to collect just what is needed to cover the costs that the department has anticipated needing to provide the services. Some of the fees or the assessments for the two provider and hospital rate proposals, those collect what is needed to provide the rate increases, and they're not called out as, taxes collected and because of the mechanism that's being used, so those are not on here. They fund those two proposals. And I'm trying to think of, some of the fees, they aren't going back to the general fund. I think we need a more specific question before I can answer. I don't have a back of the napkin response to your question.
Thank you, Senator Wiklund. Mr. Munn, do you have a comment that could help us here?
Madam Chair, Senator Drazkowski, I can't speak to all the fees in the bill, but the two revenue estimates that the Department of Revenue prepared show provider tax revenue increases of $401.3 million over 4 years for the rate increase from 1% to 2%, and then the A47 amendment increases revenue by an additional $60 million over 4 years.
Senator Drazkowski.
Thank you, Madam Chair. Thank you, Mr. Mum. Thank you, Senator Wiklund. I'm hopeful that we can have a full picture of those non-general fund tax increases in the bill as well. Some staff have provided me that there's $70 million of fee increases in the bill. I'd just like, before we get to the floor, for sure, to have a full idea of what we're doing to the people of Minnesota with this bill. And Senator Wiklund, I saw you talking to staff about my question about can we put language in the bill around the collection and fixing that. I'm assuming that that's a yes, but I wanted to see what you thought.
Senator Wiklund.
Madam Chair, Senator Drazkowski, yes, council pointed out to me the language that is already in the bill that does, it gives the commissioner the ability to consult with the health plan companies and to set the rate. And the commissioner annually must look at that, and they must modify the rate of the assessment, and they could modify it to 0, obviously. And to do that as necessary to comply with federal law, obtain the waiver, and otherwise maximize the federal funding. So I believe that it already includes the ability for the commissioner to take action. If the federal government were to suddenly say that we no longer have access to this, they would be able to take action on that.
So, Madam Chair?
Senator Drazkowski.
Quickly, so Senator Wiklund, could we actually just direct the commissioner in that eventuality rather than wonder if they're going to do it or not? I mean, I would really like to say, Commissioner, if this goes away, stop collecting the money and send the money back that needs to go back. Is that doable?
Senator Wiklund.
Madam Chair, Senator Drazkowski, I'd like to have a chance to talk about it, but I certainly can look into that. Yeah.
Thank you.
Senator Nelson.
Thank you, Madam Chair. Senator Wiklund, just to try and get a full understanding of the amount of fees, drug rebates, premium subsidies, the MCO assessment, the provider tax, all are apparently increasing the cost of health care. So there's one piece, so the drug rebates, 60 million, I think, is what's planning to be collected by the state collecting the rebates on drugs, I believe, which is, in a sense, I don't know how you can tax something that before they receive it, or it's not received. So that's somewhat concerning. But specifically to that, what about those 340B fees? Those are really important to our rural areas, and are those going to receive this taxation as well?
Senator Wiklund.
Madam Chair, Senator Nelson, I guess I'm not sure what, this bill does not contain any provision that negatively affects the 340B revenue process or the way that program works.
Madam Chair?
Senator Nelson.
Just to clarify and get on the record then, because these 340B rebates are absolutely critical to our rural pharmacies. And so I think I heard you say that 340B rebates will not be captured by the state. I just want to clarify on that. That's very important.
Senator Wiklund, would it be helpful to look back at who is being taxed relative to the A47 amendment?
Madam Chair, Senator Nelson, I guess two points. So with relationship to 340B, that program is not the revenue that hospitals and other entities, covered entities, can draw down through use of the 340B program is not a rebate program as such. It's a way that they have ability to purchase drugs at a discounted rate, and then they're able to utilize a different price point that they charge for different patients, and they receive the difference is revenue that they are able to draw in. So this bill does not affect that. The rebates that you are talking about, that we talked about with the A47 amendment, are strictly those that apply to wholesale drug distributors who use a rebate program with their customers. And the way that the tax had been working for decades, it included rebates in the gross revenues. When it was brought to court to challenge that should not be the case, the courts sided with those wholesale distributors who brought the challenge. And what we're saying is that I believe that this should be covered. These rebates should be included in that gross revenue calculation that they use to determine how much they pay in the provider tax.
Senator Nelson, we have to close this
Yes.
discussion.
Now that's not quite as clear, so I'll dig into that further. I would just say that we are raising the cost of healthcare through everything that we've done here, and we've talked about all those things. The one thing I haven't heard about that I have heard about at home is the prohibition of facility fees, and I don't know that you mentioned that, Chair Wiklund, Senator Wiklund, and how that is going to, I saw sheets about how that was going to increase the costs dramatically at our hospitals and clinics because of the prohibition on facilities fees. Do you have a number on that?
Senator Wiklund?
Madam Chair, Senator Nelson, there is a provision in the bill that would prohibit facility fees. It is something that we are in negotiation with the hospitals over. I would say that this provision was brought to us as a patient impact. Their healthcare costs are going up because they are being charged facility fees that their insurance companies at times are not covering. And so they're facing significant fees for going to a clinic that is not, in their perception, going to a standalone clinic that it may have a technical relationship to a hospital, but is not the hospital. And so I believe that it is a worthwhile discussion to talk about how these fees are being used and whether they are increasing Minnesotans' cost of health care because they're being forced to pay a facility fee for something that isn't a hospital-related item. So I think it's under discussion, and I have heard from the hospitals, they believe that it would have significant impact on them. So that's certainly part of my consideration.
Madam Chair, do you
Senator
want
Nelson?
final comments at the end?
I am going to call on someone else who
Yes.
has not spoken on this bill, and then we're going to take a vote. Senator Miller.
Thank you, Madam Chair. Mr. Mum had mentioned that he didn't have the total amount of the fee increases in the bill, but he did give the two tax increase amounts based on the revenue estimate. Can you just repeat those amounts, Mr. Mum? I believe it was right around 500 million total, but I just want to make sure that I have those
Well,
correct.
and Senator Miller, the one from the A47 amendment.
60 million, I have that one in
is in
front of
there.
me.
Okay.
Thank you, Madam Chair. The other one I
bet.
didn't have in front of me was the provider tax increase and what that raises over the
Sure.
next 4 years.
Senator, Mr. Munn.
Yeah, Madam Chair and Senator Miller, the rate increase for the provider tax would increase revenue by $401.3 million. I can send you that revenue estimate as well, so you have that on hand.
So, Madam Chair,
Senator
Mr. Mum, so it's the 401.3 million plus the 60 million would be $461.3 million in tax increases plus the fees that
Or
will
including
hopefully.
the fees. The 460 includes the fees.
I don't believe so. I
No,
believe this is
okay,
just the tax increases.
Thanks for raising this. I think it's important that, Senator Miller, I think it's important that all of us hear the same thing, and that's not what I heard, so I
Yeah,
appreciate that.
thank you, Madam Chair. So I just
Yeah.
want clarity. So a $461.3 million tax increase plus the fees, which Senator Wiklund will hopefully have for us by the time we go on the Senate floor. Madam Chair, Mr. Mum, is that correct?
Ms. Run.
Yep, Madam Chair, Senator Miller, correct. The $461.3 million figure is just revenue from the provider tax
Provider
changes, exclusive of any other revenue sources in the bill.
Thank you.
Thank you. Senator Drazkowski, if it's really important, yes.
Just-
Otherwise, we need to close out the committee. Senator Drazkowski.
Just quickly, those are four-year numbers, but we don't have the two other taxes in the bill, both the managed care assessment and the health insurance premium subsidy one. Those are outside of the general fund, but they're tax increases. So I'd be interested in those as well as part of the discussion.
Mr. Munn?
Madam Chair and Senator Drazkowski, I don't believe those would be reflected in a revenue estimate from the department. Perhaps there's a fiscal note that outlines the revenue that would be generated by that assessment and any other fees or revenue
Senator
sources.
Drazkowski, I believe in our packets are the fiscal notes, too. So maybe you can take a look at them.
So Madam Chair and Senator Wiklund, when we get to the Senate floor, would it be possible to have a total number of the tax increases, whether it's general fund or other fund, tax increases and fees, just so we have a better understanding of what we're voting on when we get to the Senate floor?
Senator Wiklund.
Madam Chair, Senator Miller, I'd be happy to be able to provide that along with the healthcare, the essential healthcare coverage that we are providing and the impact on communities by having these increases. We are providing the increase in the provider tax to be able to avoid severe cuts to healthcare programs, Minnesota healthcare programs. Those are programs that not only affect over 1 million Minnesotans in their access to healthcare, but also affect communities all over the state who have hospitals and providers, excuse me, and their economic role that these Minnesota healthcare enrollees play in providing, services or, to enrollees. And so I think I would be happy to be able to discuss the whole context of the bill and what it is accomplishing and the positive impact that it would have on Minnesotans.
Okay.
Thank you,
Senator
Madam
Miller,
Chair. But
sufficient?
just to make it clear, though, we'll be able to get either a spreadsheet or some sort of document that has certainly what the fees are, and then you'll explain what those fees are being used for and taxes.
Senator Wiklund and Senator Miller, that also this bill has another stop before it does get to the floor and may be amended there. Senator
Excellent.
Wiklund.
Thank you.
Madam Chair, Senator Miller, many of these items are included on the spreadsheet already. So I would say that I will try to think about how it can be more clear or easily readable, but a lot of the information is on the spreadsheet.
Senator Miller?
Thank you, Madam Chair, and thank you, Senator Wiklund. Clearly, there was confusion
Sure.
in this committee, so I think it's good for all of us as members to know exactly what we're voting for. And I realize it's on the spreadsheet, but that doesn't always indicate what the tax and fee increases are. So I look forward to hearing more about that when we're on the Senate floor.
Okay. Senator Klein moves that 2669 as amended be recommended to pass and referred to the Committee on Finance, and there will be a roll call. Secretary will take the roll.
Chair Rest,
Yes.
Senator Klein,
Yes.
Senator Weber,
No.
Senator Dibble,
Yes.
Senator Drazkowski,
No.
Senator Hauschild,
Yes.
Senator Miller,
No.
Senator Nelson,
No.
Senator Putnam.
Yes.
The motion prevails, and the Senate File 2669 as amended is recommended to pass and will be re-referred to the Committee on Finance. There being no further business before the committee, we're adjourned.